Now, for many people, COVID has, of course, changed their lives forever. For long COVID sufferers, the extent of that change is yet to fully unfold. Many believe the long-term implications of the disease are not fully recognised, and some have taken their treatment into their own hands. One of those groups now says they may have found a breakthrough, although the research on that is still at a very early stage. But they do hope their findings could also benefit people suffering from other long-term health conditions. And we're going to talk about this now with Dr. Beate Jaeger, who runs a specialist COVID clinic in Mulheim in West Germany, and also Dr. Asad Khan. He's a medical professional who became a long COVID sufferer after contracting the virus from inadequate PPE equipment. He's receiving treatment at that clinic now. So Beate, first of all to you, just talk us through the treatment that you're offering.
The treatment good morning first. The treatment I'm offering is called H.E.L.P Apheresis. H.E.L.P stands for heparin-mediated extracorporeal LDL cholesterol precipitation. So basically, we do this in Germany for 37 years now. It's a treatment, a last resort treatment for patients suffering repeated heart attacks, myocardial infarctions, after heart transplantation, severe peripheral limb disease and hypercholesterolemia.
And just in very simple terms, just try and put that into layman's terms if you could. How does that treatment work?
This treatment eliminates clotting factors, LDL cholesterol, bacterial toxins, and cytokines. And when we got the first hints in COVID pandemia last year, the signs from the pathologist showing us that COVID is a vessel disease, then we tried to work on this, and since February this year, we tried to cure long COVID patients from all over the world.
Well, let's talk to one, Dr. Asad Khan. You've been suffering from long COVID. Just tell us about, well, first of all, the symptoms that you've had, but then also the treatment you've been getting.
Certainly, thank you very much. So I acquired the illness on a respiratory COVID ward in November 2020. I developed unbearable skin rashes, memory loss, inflammation around the heart, bladder incontinence, and a disabling condition called POTS, which made it impossible to sit or stand due to nausea and dizziness. And by August, I was losing weight. I was lying in a darkened room with blindfolds and earplugs, and I honestly didn't care if I fell asleep and never woke up again. And I've had to be my own doctor, researcher, and advocate. And while some clinicians have empathized and believed, others have suggested that it would just get better with time, or it was psychological, or that they were waiting for research and they couldn't do anything in the interim. And despite my knowledge and my access, it's been a nightmare to get the right care. I can only imagine what it must be like for the average person. And as for the treatment, it's quite simple. It's similar to dialysis. Blood is taken out of one arm, it's run through a machine which cleans it of blood clots, and it's returned to the other arm. I've had 7 cycles of this treatment so far. My blood was so full of clot material that it blocked the machine on 4 occasions. They've pulled multiple clots out of my arm veins, and what is really interesting is that all of the usual clotting blood tests, like D-dimer and fibrinogen, were normal in my case.
So how are you feeling now?
Well, I arrived in Germany in a wheelchair, and I nearly fainted in the clinic waiting room. But now, after 7 treatments, I can walk short distances, I can look at a computer screen, I can read scientific texts again, I can eat foods I had become intolerant to, and thankfully the nausea's gone. I still have more treatments to go, but I do feel like things are moving in the right direction, and it seems like I finally got a chance of getting my life back again. This appears to be a really promising treatment. Clearly, we need more resources and funding because the last thing I want to see is desperate patients being forced to self-medicate with potent drugs like anticoagulants. Therefore, experienced clinicians should feel able to discuss these treatments with their patients, weighing up the risks and benefits, because researchers from Cape Town and San Francisco have demonstrated microclots in the blood of long COVID sufferers beyond a shadow of a doubt. It is a myth that long COVID and other invisible illnesses such as ME are psychological just because certain tests are normal. Patients can be very sick with normal tests, and it is quite clear that in long COVID, our tissues are starved of oxygen due to these clots in the blood vessels. We are not deconditioned, we are not anxious due to the lockdown, and talking therapies and rehabilitation are not going to fix this. Exercise only makes us worse, and patients who are sick for months and months are unlikely to get better on their own. A simple bedside test called a venous oxygen saturation can demonstrate how ill we are.
Okay.
Mine was 32. The normal adult range is 65 to 75.
And just briefly, Beate, to you once again, Dr. Beate Jaeger. Long COVID is clearly a phenomenon we are still struggling to learn about. But do you think this could be the key to understanding what it is doing to the human body, these microclots?
Yes, I think this is a key phenomenon, and Professor Pretorius and Professor Lautsche were the first to demonstrate that it's very difficult to dissolve these clots, and they now come to join my clinic in the middle of November, and we will. They come to revalidate my results from treating by now 104 patients. But the good news about it is that some people just need one treatment and they can get rid of all symptoms. Others need 5. I've been treating a printer from the UK. He needed 14 treatments. That was the maximum, but he came in with a wheelchair and he walked out upright on his feet. And this is a cruel disease, and it affects worldwide 400 million people. And the mechanical removal of clots is one possibility. Anticoagulation will help also. So we just have to demonstrate that this is a generalized vessel disease and people need quick treatment, because my patients were all very young, very sportive, doing marathon, being caretakers, being children of my patients, being really people in the middle of their lives, and they should have it back.
All right. Dr. Beate Jaeger, fascinating to hear about that treatment, and also Dr. Asad Khan to hear about your treatment, and very good luck actually with your recovery. Let's hope it continues. Thank you so much, both of you, for talking to us today. Thank you.